Hi, how are you today, sir? My name's Kristen. I'm going to be your nurse today. I have an order from your doctor that I need to start an IV for you and a medication for nitroglycerin, which is for your chest pain.
The nurse reviews the physician's order for the type and amount of IV fluid or medication, with the rate of the fluid administration, and if there are any potential incompatibilities with other drugs. The nurse follows 6 rights of medication administration. The 6 rights are the right patient, medication, route, time, and dose. The ID band is checked to identify right patient. The nurse checks the IV solution for color, clarity, and expiration date, and for any further leaks. The nurse assesses the patient's history of any drug allergies.
Sir, did you have any drug allergies?
No.
Okay.
The patient is prepared by explaining the procedure, its purpose, expected sensations, and what is expected from the client. The patient is assisted to a comfortable lying position. Hand hygiene was performed again and new gloves are applied. Equipment such as IV start kit, IV catheter, alcohol swabs is organized on a clean bedside table. The nurse opens the sterile IV start kit and prepares for IV infusion. The nurse opens the infusion set, maintaining the sterility of both ends of the tubing, and also makes sure the tubing is clamped. The protective sheath from the IV bag is removed and the tubing insertion spike is inserted. The spike should not be touched. The nurse compresses the drip chamber and fills it to 1/3 to 1/2 full. She then primes the tubing by filling the IV solution to the needle adapter. The tube should be free of all air bubbles. Once the tubing is primed, the roller clamp is closed off. The cap protector is placed on the end of the infusion tubing. The nurse now prepares for the insertion of a peripheral IV. An accessible vein is identified for the placement of the IV cannula.
Once the site is identified, usually it's the most distal site and the non-dominant hand is preferred. A tourniquet is applied around the arm 4 to 6 inches above the insertion site. The nurse uses her index finger to palpate the vein by pressing downward and noting the bouncy feeling as pressure is released. Then the site is cleansed with an alcohol swab and allowed to dry, and then cleansed again with betadine or iodine. The nurse anchors the vein by placing a thumb over the vein and gently tightening the skin distal to the site. The client is then warned of a sharp but quick stick. The venipuncture is now performed by holding the needle at a 10 to 30 degree angle with the bevel up, slightly distal to the actual site of the venipuncture. The nurse observes for the blood return, and the needle is lowered while threading the catheter into the vein. She continues to hold the skin at the venipuncture site. The cannula is stabilized with one hand and the tourniquet is released with the other hand. Gentle pressure is applied above the insertion as the stylet is retracted. Sharps are placed in the sharps container. The nurse connects the saline lock to the end of the cannula, then flush the injection cap with normal saline to check for patency. The cannula is now secured by placing a narrow piece of tape under the cannula hub with sticky side up and cross tape over the catheter hub to make a chevron. A sterile dressing is applied over IV site and make sure the connection between IV tubing and catheter hub is uncovered. Tape is placed over the transparent dressing and date and time of placement is recorded with the nurse's initials. Now the nurse is ready to connect the saving lock to the primary infusion tubing.
The nurse now documents the procedure performed and continues to check the site throughout the shift, noting if there are any adverse effects from medication and tolerance.
Sir, I went ahead and got your IV started for you. I'm going to go ahead and get your doctor, and he'll be right in just a few minutes.
Okay, thank you so much.
You're welcome.